Okay, so welcome everyone to the first webinar in the Teach Resiliency Education series. This webinar is titled Share2Care, Promising Mental Health Initiatives for Your School. My name is Trisha Zachariah, and I'm the Director of Programs and Education at PHE Canada. Teach Resiliency is a program of PHE Canada, and I support with the development and the implementation. I'm going to be introducing our presenters tonight, as well as supporting the delivery of the program. Of the webinar. This is the first webinar, as I said, in a 4-part series of the Teach Resiliency Education series. At the end of the webinar, I'm going to share the other topics for the other webinars and the timeline for when those will occur. So just a few administrative items before we start and get into the content. Everyone will be muted throughout the webinar. At the end, we will ask participants to use the raise hand tool if you have a question or you want to share something. And at that time, we'll unmute your line and then you'll be able to speak and everyone will be able to hear you. We'll do our best to watch out for any logistical questions that are asked in the chat box throughout the webinar. Just as we're talking, we'll do our best to type. If you do hear some typing in the background, it's just us answering a few questions. And yeah, those are the logistical items. The next slide is I'm going to present who will be speaking tonight and sharing some of these wonderful promising practices and other information. So it's my pleasure to introduce these colleagues of mine. The first one is Dr. Susan Rodger. She's a psychologist and associate professor in the Psychology Counseling Graduate Program in the Faculty of Education at Western University and is also a research associate at the Center for School-Based Mental Health. Dr. Rodger and her team have been an integral partner in the development and implementation of Teach Resiliency and continue to provide expertise and support. Ryan Foy is passionate about all things physical and health education focused. He's originally from a small town in Nova Scotia and has a passion for physical and health education and it's taken him on various journeys. Since graduating from St. Francis Xavier University in Antigonish, Nova Scotia, Ryan has worked in multiple education roles around the world, including 1 state capital, 1 international capital, and 1 provincial capital. As the lead of special projects and campaigns at PHE Canada, Ryan leads the Share2Care campaign, promoting it across the country and connecting with educators about their mental health activation initiatives. And finally, but not least, Sue McDonald is a teacher and counselor at the Center for Learning Alternatives in Prince George, British Columbia, and she feels she has the best job in the world. She is able to use her physical education degree and her registered clinical counselor designation to help assist students positively connect their mind and their body. She specializes in outdoor education and has taught kindergarten to grade 12 in her 30-year career. So welcome to those presenters. So our agenda for this evening is to give a very brief overview of Share2Care and as well as Teach Resiliency. We will also talk about the components of promising mental health initiatives. We'll then move into discussing promising practices. So these are examples of innovative and promising mental health practices that are having a positive impact on students or school staff or both. And then finally, at the end, we'll have a discussion period. So for those of you who are not familiar with Teach Resiliency, it's an online portal offering educators simple to use strategies and tools to assess resilience needs and provide resources to promote and enhance teacher and student mental health. It was developed in partnership with PHE Canada, Western University, and the Center for Addiction and Mental Health. Teach Resiliency is designed to develop, enhance, and support teacher competencies. It's also meant to enhance and support mental health literacy for teachers, to offer effective and practical strategies to support child and youth resiliency and mental health, and to offer effective and practical strategies to support teacher resiliency and wellness. So what you see on the screen are the 4 themes of the resources that are available in Teach Resiliency. Currently, there are over 175 English resources and 45 French resources, anything from podcasts to tip sheets to programs and much more. The resources are developed by the team of educators, mental health professionals, and health and education leaders. They're curated according to guidelines that include resources that are free or low cost, that are evidence-based or promising practice, available to teachers, high quality, and we're continuously adding new resources as we review them. So moving into Share2Care, you see a number of facts that I can let you read through on your screen from this campaign. It's a mental health activation initiative, and it gathers promising practices from across Canada to inspire others to take action in their class or school community. It was launched in October 2018, and it encourages schools from across the country to share their unique and innovative school-based or board-based mental health initiative. The idea for the campaign was developed with the program partners as well as the cooperators. And really it was to answer a need and allow people to connect from professional to professional and share and really connect the country with what's happening and great ideas of what others are doing because of the increased need for mental health initiatives across the country. It was extremely successful, and it proving the need for increased support. We had over 224 submissions received from across Canada, and 5 recipients were selected to receive funding. Each recipient received $2,000 to support the growth and sustainability of their mental health initiative, with over 172,000 children and youth being impacted. However, it's important to note that many excellent initiatives were submitted to the Share2Care campaign, and we really want to commend everyone for the work they're doing to support mental health in their school or their school board. So I'm going to pass it over to Dr. Susan Rodger. She's going to talk through the components of what makes a quality mental health activation initiative.
Okay, thanks very much for inviting me to be part of this. I think one of the most exciting things about the Share2Care campaign is the way that we get to share from peer to peer what we're doing and how we're doing it, inspire others, get some great ideas, and learn from what others are doing. So we had many applications last year, and in order to look at those applications, we developed a transparency tool, a criteria tool that helps us to look at each of the components of somebody's application. So these are our guideposts, I guess. Yeah. So the first one is the rationale and relevance. It's important here to talk about the reasoning behind doing an application, behind doing a project. What's the demonstrated need? How do we know that there's a need in your school, in your classroom, in your community for a particular program or resource? What kind of data are you using? What kinds of evidence are coming forward that says that this needs to be done? So we set the stage with the rationale and relevance. Then we look for the action plan, and this really is reflecting best practices. So we want to understand how each of these programs, each of these promising initiatives, how do you do it? And how do you know that you're doing it in the very best way possible? And in one of the big parts of doing something in the very best way possible is that it's feasible, that we can actually get it done and have a good chance at meeting our objectives. And those objectives in this case would be improving the mental health and resiliency among teachers, among students, or both groups. So our third component is the learnings. You know, this is so important, right? Because people around the country amazing things, and we need to learn from each other. So how do we know that a program or an initiative or a resource is helping us get to that end goal? We want to have clear and tangible indicators of progress, of success, that describes the connection between the objective of the initiative and the outcome, right? So then those outcomes can be part of a larger school initiative plan or another policy initiative. So we want all those things to be connected. Sustainability and scalability is so important, right? Looking at how the initiative can be maintained. We look at these initiatives as proof of concept, as something that if we can demonstrate at once, then we can find and leverage other resources to keep it going. We want to know what you think about how it can be not only maintained, but how it can grow, maybe spread from school to school. How can it be adapted to other school needs? A big part of this too is about inclusion. All children belong, all people belong, and we want to have a good understanding and a good consideration of how exceptionalities and all forms of diversity are taken into account in a way that is respectful and inclusive. So good practices of teachers in this country, thankfully, are in things like universal design. And so we want to see that in the promising practice initiatives. And finally, there's the scope. We want to have a good understanding of who's going to benefit, because it may not be just the people who are directly involved with the initiative. How is it relevant within the school community? How does it lift? How does it change not only the people within the actual program, but those on the margins? How does it promote wellness in the school or community, and what opportunities are being created? And I think a great example of opportunities that are created is when we use getting young people involved to mentor one another. Yeah.
Perfect. Thank you, Dr. Rodger. So now we're going to move into hearing about some of the Share2Care promising practices that were submitted as part of the campaign. And again, this is meant to share what's happening from teacher to teacher, amongst school boards, things that are happening with students. Some are happening with involving teachers as well that we received via Share2Care. And we are calling them promising practices, and because that's exactly what they are. And we feel that they're worth everyone knowing exactly what's involved with each of these. So the first one that we're going to move into sharing is the Center for Learning Alternatives. And so Sue McDonald's going to present. Sue, I believe you're already unmuted, so we should be able to hear from you, and over to you to talk about the Ventures program.
Can you hear me?
Yeah, loud and clear.
Excellent. I was a little worried the technology might not be working, but so I work as a teacher and counselor at the Center for Learning Alternatives. And just to give you a little bit of background about our school is a school for students the mainstream school doesn't work for. So we are still part of the public school system, but for some reason or another, and it could be anything from drug use, it could be mental health, it could be all sorts of things. Students have had challenges being successful in the mainstream public schools. So they come to our school and they never want to leave, which is a really great thing. So we have several hundred students in our school, but our initiative is mainly focuses on outdoor education, physical education, and leadership, so a combined studies program. This year it seemed to be a good fit to apply for this because this year our administration really committed energy and resources to helping us all become what the district referred to as a trauma-informed school. We have a very high percentage of First Nations students, About half of our students have an official mental health diagnosis, and many, many more have uh, unofficial diagnoses. I guess they have never had the paperwork or the resources. So really our students must have exhausted all their mainstream school supports and be really in danger of not finishing in school. So we have lots of supports in our school and a really engaged administration. So I have 18 students in my ventures program. There's other initiatives that also include other students, but my core group are 18 students, and their attendance rate in the ventures program is about 25% higher than our mainstream, our attendance of the other students as well. And I think a lot of what I attribute that to is the sense of community. Lots of our youth are really looking for that community piece. And unfortunately, sometimes youth that we would consider at risk find community in not good places. So our initiative, the goal is to create a community, a safe, inclusive environment where students are successful through utilizing physical education and the power of nature and outdoors, and also giving them some opportunities to be leaders, which in turn increases self-esteem and confidence in all those areas, which is often lacking in our students. So the students actually go through a process to interview for the program, because when I designed it, I wanted it to be something that it wasn't just come in the program and we'll write your name down. So students go through an interview process, and they have to have references and things, just much like a job interview. And our thought that those skills are all really important for youth to have anyway. So they go through that whole process. So it becomes a bit of a really valued program that they're part of, and they become leaders in the school. So they do leadership activities in our school, but also in the community. They're very involved in our community. So the idea is that connecting kids to their community helps retain them in the community, helps boost their confidence, helps them be successful after they leave us when they graduate, and that community connection is important. And another kind of facet that we really believe in is that not everything is going to work for every student. So we offer them a lot of choices, with the understanding that, hey, this might not be your thing, but you can say you've experienced it and you've tried it. So we do lots of different things, and students kind of, some things resonate with them and some of them don't, but hopefully those things will help them moving forward, and help them become more connected and also truly more employable and more engaged members of society when they graduate. So, for instance, they work with younger students, some of them. We do trail clearing and trail building at our cross-country ski area, and in turn, they give us cheaper cross-country skiing. So it's a win-win for us too, and the business manager is happy for things like that. So, and lots of certifications, and we were able to do that through some of the Share2Care money that we received. So students first aid certification, high five principles of child development training as well. And as a result, there's several of the students that are going to be employed this summer working with youth. So that's a direct result of the benefit of the Share2Care funding, because it was a pricey certification, and the students now have that, and it's helped them connect to the community. A big part of the initiative is the therapeutic piece that we tie into that. So at the start of every class, we do a check-in circle, and so again, that brings in that community piece. So how I have my classroom set up is pretty cozy and pretty comfortable in beanbag chairs and things like that. The students come in, it's a safe place, and we do a check-in. just a, kind of how are you 1 to 10 sort of thing before every single class. And students just say, I'm a 6, I'm not having a great day today. They can share details if they want or not. And just to share a little bit with you guys, I have a student that's thankfully going to make it through. There was lots of ups and downs, and every class for about 6 months, he'd say, I'm a 10 as usual, but he clearly was not a 10. And finally one day he came in and he said, I'm a 7 today. And that was a huge moment because he was actually feeling safe and comfortable. And then he shared some things within our group that really kind of, I guess, showed the power of community. The students are buddied up with each other, so they have a buddy check-in student as well, just to help, check in on those tough days, because the students sometimes have tough days as well. So their buddies help check in with them and keep them accountable and give them some encouragement in a way that, as adults, that we just can't do, I guess. We do a lot of mindfulness work, almost all outdoors, and that was one of my big learnings, was how beneficial they found that. And at the start, the students kind of thought, well, this is stupid, this is just meditation stuff, and I tried that, it didn't work. And they really enjoyed the different ways that mindfulness was incorporated, and my youth care worker was instrumental in that as well. So having them incorporate mindfulness into the nature and physical activity piece, whether it's outdoors, drawing, photography, doing yoga outside, whatever that might be, embedding in that mindfulness piece. The other part that's really we found beneficial was, at the end of every class, we also do a check-in, and they are never lower than what they were at the start of class, and helping them see, okay, so you were a 6 when we did check-in in the morning, and now you're a 10 plus. Let's reflect on that a little bit. So the goal with that is that they make that connection between being outside in nature, being in a supportive community, being physically active, to their mental health. So that's just a few things. I mean, I could go on forever. We do some amazing things. The students have adopted journaling practices and things like that as part of it as well. Just to speak a little bit about roadblocks, I believe that was something that we were to reflect on a little bit. I think for me, it's sometimes the paperwork and administration piece is always challenging, because that seems to be more and more. Keeping kids connected that have mental health issues is always challenging. So finding ways to keep kids engaged and do that on a regular basis is always challenging. So the buddy system works well with that, having them check in with us on a daily basis, even when we don't have them in class, that kind of stuff. Because lots of our students have extreme anxiety or mental health. So those are some of the roadblocks, I guess, that we've found as challenging. Some of the things that I personally learned from this is that the staff needs this as much as the students. The staff, when working with this population, it's very stressful on the staff. And my regular youth care worker had some health problems, so I'd have different staff, and then they never wanted to leave. They enjoyed it so much. They enjoyed this way of connecting with the youth. So it was just really showed me the benefit of having all staff in the school engaged in this kind of work with youth, and having those opportunities with youth, rather than giving them booklets in the classroom. So I probably had half a dozen different staff that were involved this year, and all of them are, really were just amazed at the power of that. So next year we're looking at some ways to expand this kind of practice, doing a walk and talk. We're really close to trails, so incorporating that, we're going to start 2 days a week, just doing a walk and talk with the whole school. So those kinds of things. and just yesterday, our administration agreed to have a counselor that also works with the staff and mental health as well, to keep them well for our youth. So there's some really good things that have come out of it, I guess. Yeah, I'm not sure what else I can talk. I could talk forever about this, but yeah, I think
Sure.
the main thing is having students connect their mental health and their physical health, through various ways, and just having that dialogue, and whether it be a verbal dialogue or whether they do in their journal or whether they're sketching or whatever that may be, having them connect that, so when they have those low days, they can make that connection. You know what? I'm having a crappy day. I'm going to go for a walk. I'm going to go sit under a tree. I'm going to practice those grounding techniques or whatever. So having them adopt those practices into their life, I guess, we found very beneficial.
Perfect.
Yeah.
Thanks so much, Sue. That's great. Lots of learnings there and shared. And I think what we'll do is we're going to hold, there might be some questions for you. So we'll hold till the end, and then we'll open up the lines, and we're excited to hear from people. So thanks so much for being with us and sharing that. We'll move on to some of the other initiatives, promising practices that we want to share as well. So Ryan is going to present a few others. We would love to have other champions on the line, such as Sue, but with busy schedules and everything, we weren't able to. So Ryan has connected with each of these promising practices and is representing them tonight. So we're happy to have them, and their spirit hopefully will flow through him tonight. So the next one that will be shared is the peer support volunteers in La Ronge, Saskatchewan.
Okay, so just a little bit of context around Churchill Community School. So Churchill Community School is a grades 7 through 12 school with a student population of about 550 students, 90% of which identify as First Nations or Métis. And as Trish just mentioned, this school is located in La Ronge, Saskatchewan, which is about 4 hours northwest of Saskatoon, Saskatchewan. And the initiative here, the promising practice, is actually very simply noted and titled as peer support volunteers. And what had happened in the community of La Ronge, there had been 3 suicides over 4 years in the community. And due to the response to that trauma in the community, the school was granted a second social worker, as they already had one in the school to support the youth and mental health within the school. So they moved from 1 to 2 social workers in the school. The students then identified that was not enough, that they wanted more, and back to what was referred to and mentioned earlier, more, but on the peer-to-peer support level. So 2 students actually approached a teacher within the school and asked if they could start this initiative called the Peer Support Volunteers. So the power of 2 students was huge at this school. And what happened was those students were able to undertake some training through the Teen Talk program, which is a great program that stems actually out of Winnipeg, Manitoba, and is a great support and a great year for youth support around mental health. And those 2 students were able to recruit and build their support volunteer group to now having 12 students in their peer support group trained through the Teen Talk program. It is a peer-to-peer selected program, which is really interesting, really great to see within the school. And the school plans to have another 2 to 4 students undergo that training as well to be also within the peer support group. Some of the initiatives that the peer support volunteers facilitate in their school, they run healthy activities. They discuss different topics such as how to sustain healthy relationships, substance use awareness, the sexual wellness, diversity, body image, and family issues. In addition to facilitating conversations in those areas, they also utilize the school facility for activities such as movie nights and dances and different games as well. So when we look at the comprehensive school health approach, we know that the school community is just that. It's beyond just the classroom. It is the entire school community, and through this peer support volunteer initiative, it is really great in their capacity to utilize the school for just beyond education and learning. Some of the pieces that the school has identified and the group has identified, the ways that they're going to use their funding that they receive through Share2Care. We're supporting the school with tube purchases as well as a student retreat, and just very similar to what Susan just shared around the importance of the outdoor environment and getting students in that outdoor environment. This is something that was also identified within the peer support volunteers. The students wanted a retreat where they could connect intentionally with fellow students and be a listening ear, an empathetic ear to any issues that may be arising. So in terms of overall overview of this initiative, it really is about building bridges, and it really is about students being the gatekeepers to those bridges and just providing that platform, listening to them and allowing them the space and the capacity to make those bridges form. So, yeah.
Great, thank you. So the next one that we will share, the next promising practice, is Knollwood Park Public School. Their initiative is kindergarten outdoor play, and Ryan's going to share a little bit of information about that as well.
So Knollwood Park Public School is a K-8 school located again in London, Ontario, and just a little bit of context about the school and the community. This school is actually one of the oldest running schools in the London area, opened in 1920 as a 2-room Red Cross hut. The school has now grown to 260 students from grades kindergarten through 8. And this is a school that the surrounding community has various circumstances and challenges, one of which is low socioeconomic status, and it is also a very diverse community in terms of a lot of new Canadians moving to the community. So the response here in terms of the promising practice that was identified by Marlene Wasco, the principal of this school, was titled the Kindergarten Outdoor Play in Sun, Rain, and Snow, or Kindergarten Outdoor Play. And again, a very simple response to a very simple need, and that all students deserve the right to play, and they deserve that right to play in all environments, in all climates, especially in Canada. And we know in Canada that is tough due to different weather and the climate that we live in. So the whole initiative wanted to move the school from a task-oriented morning routine to a play-oriented morning routine. So instead of students coming in and doing task A, B, C, and D, and then O Canada and the school day starting, they wanted to change that. And the reason why they wanted to change that is because teachers in the school had identified an increase in behavior management issues within the classroom. Time on task wasn't as high as it should have been, and some teachers took it upon themselves to take students outside for some student-led play activities prior to the school day and noticed that there was a downward trend in those behaviors and greater time on task because of that. So that kind of pilot grew across the entire kindergarten program, and then across the entire school in terms of informing a soft policy around shifting their entire school schedule to allow for a minimum of 1 hour of outdoor student facilitated play. And it was a tremendous response in that it was not teacher led. Again, it was student led, but the teachers were able to go outside with the students before the day started, get to listen to them, understand the needs, understand a bit more about their family background if they're new to the area, and just a great opportunity in a playful and active outdoor environment to get to know their students a bit better. Essentially, if you could kind of give an overview of this promising practice, it is the freedom and fresh air, and the importance of giving students the freedom to move and play and to be intrinsically self-motivated to do that is important, just as is the fresh air component. Some of the outcomes, again, that readiness to learn, teachers have reported that is very high within the school. And then the need really there was, how can we provide equitable play opportunities in all climates in Canada? And so as you can see from the photos on the right-hand side, Principal Marlene, with all of those boots and toques and mittens, they were able to use their Share2Care grant funding to support the students that may be coming to their schools and not be able to play because they didn't have the proper clothing in the winter and the spring and the fall. So this has been a huge opportunity for this school.
And the final promising practice that we'll share this evening is from New Germany, Nova Scotia, and it's the free store, and Ryan will share a little bit about that initiative.
So New Germany is a rural part of Nova Scotia that is about an hour and a half outside of Halifax, Nova Scotia. Just like the name suggests, it is a rural community. The high school is actually across the street from the elementary school. The high school has 330 students between grades 7 and 12. Within the greater New Germany community, 1 in 5 students live in poverty. And so as a result of that, many of those students attending both the elementary and the high school are often coming to school undernourished or without the adequate clothing that they need to participate in school activities. And we know that can have an effect on learning. We know that can have an effect on health, and especially with mental health in terms of that sense of community and that sense of belonging within the school community. And so their promising practice was the Free Store Initiative. And I do want to draw your attention to the link below, which is actually a news clip, which really highlights this Free Store Initiative well. So again, this store really formed when we look at that comprehensive school health. It was the school reaching out to the community to build that partnership. And they wanted to provide things like food, things like hygiene products, and things like clothing to families that need them, because they knew that students needed them. And so the school took it upon themselves to facilitate that partnership, got local buy-in from different businesses within the community, and they actually created a store within the school. As mentioned, the store provides many different things. As you can see on the left, the photo on the left, there's some clothing there. In the middle, some food products, and on the right, hygiene products as well. The Free Store has changed the way that the school interacts with parents. Where it is a highly rural community, many of the students take the bus, and so getting parents to the schools for various activities prior to the Free Store was very challenging. But now with the opportunity of the Free Store, where parents can come in, they can actually quote unquote shop. They can select what items that their family and what they need to take home, has changed the relationship with parents and the atmosphere of allowing and welcoming parents to come to the school, not just on a parent-teacher night, but anytime that they need anything. And it really allows the school to become the epicenter of the family. And so as a result of this, one of the learnings that their principal, Evan Monahan, has shared with us is that parents are more willing to volunteer for school activities, participate in field trips, and really anything that the school needs of them. They're very responsive. And I think it has to do with the gratitude that these families have that they can access the store. The store has since grown so big, and it's been so popular with many items either being donated or the school being able to purchase, that instead of the teachers and the principal running the store, because their role is to educate and administer the school, they've turned it over to their grade 10 students to lead. And so again, back to the peer-to-peer leadership that Susan talked about in BC, that student leadership piece is being facilitated through the grade 10 community-based learning class in conjunction with the free store, where the students actually manage the clothing and the food and the hygiene products that are needed in the store. And finally, when we look at the overview of this initiative, it's the healthier students and the increased partnerships. And that all fosters that sense of belonging for those students. And they can go also take something home, say from the free store, on the bus with them, and they can go home knowing that they're going to have a good meal at night and that they're going to have breakfast in the morning. And we know that that contributes positively towards mental health with children and youth.
All right, thank you so much for sharing all those. That was great. So as you can see that there's wonderful practices that are coming out there, anything from rural to urban, diverse groups of students, everything we heard from peer-to-peer to mindfulness, outdoor play, and much more. And I just want to reiterate that these are just a few of the really great initiatives that we received from across the country, and we were overwhelmed in a good way at the response and to read all the excellent things that are happening. So what we're currently doing is taking many of these promising practices and working with those champions and creating resources or promising practices on the Teach Resiliency website. And so we've started those, and if you want to look at them and read more about these initiatives, you can go to the Teach Resiliency website, and there's a filter button in the main area right beside the search bar, and when you click on that button, you can actually choose on the far right side, you see a promising practice selection. You can choose that and it will pull those up for you directly. We're going to keep adding these as well, and we're working on even more from this recent Share2Care campaign, so you can keep checking back there. One thing I did want to also state is that the Share2Care campaign with support from the cooperators will be launched again in September. So the expected launch date is September 18th of 2019. So we do encourage you to consider submitting mental health initiatives that are happening at your school and your school board, either with staff or students, or both staff and students. And so we're really looking forward to hearing more and continuing to work in a way that we can share with some of these great things that are happening across the country. So in saying that, we did want to open up the floor for discussion and questions. So you see a number of questions there on the screen. These are just guiding questions for you that we can talk through. You can also, we're opening the floor if you have questions for any of the presenters that have spoken tonight regarding any of the promising practices or anything around mental health initiatives that you're curious about. So in order to ask a question, you do have to click that raised hand button in your GoToWebinar panel. Whenever I see that your hand is raised, I will unmute your line, and at that time I'll say your name, and you'll have the floor to ask your question or to share your story, to share something that you're doing across the country that you want to share as well. All right, so I see a question from Natalie Bacote. So your hand is raised. I'm going to unmute your line, and so you should be free to ask your question or share right now. Natalie, are you there? Okay, nothing there. All right, Erin Diamond, there looks like you have a question, so I'm going to unmute your line now.
No, sorry, I don't have a question. I must have hit that mistakenly. I'm just listening. Thank you.
Okay.
So I think one of the themes that I hear about, and this is Susan Rodger here. So I work with a lot of teachers and a lot of schools on the topic of mental health literacy and wellness for teachers and schools. And one of the things that I hear a lot of people talking about is that the level of stress seems to be increasing, and the level of anxiety seems to be increasing. And I think it's really important to notice that. One of the things that I think a lot about is that teachers and other people in the helping professions are drawn to their vocation because they want to help. They're drawn to being a teacher or being a nurse or whatever capacity they have, because they see a need, they see a way to help people, and they want to do that. And a lot of times the need for action can create within us a sense of stress because we feel like we have to fix something. And I am here to tell you that just by noticing the mood of another person, noticing that your colleague seems a little bit down today, or that a student seems a little bit more dysregulated than is typical, that is often enough as we bear witness to each other's state of that we're in on a daily basis, and we feel like someone notices us. This is one of the greatest things we can give. And it doesn't require a program. It doesn't require a specific resource. It just requires us to be present. So when I think of the mental health needs that are obvious and that are really compelling us to talk about these things, I just want to say I encourage everyone to do what you can to put yourself in a state of being that you can be present for each other and just notice what's going on, reducing that sense of busyness and increasing that sense of noticing. That's one of the things I think about.
Wonderful. So it's pretty quiet out there, but I do see one other question. We'll just check in to see if it's a question. Looks like it's Jorge Nolasco. I'm going to unmute your line, and if you do have a question, we invite you to share it, or a story, we invite you. So you should be unmuted now. No, I don't hear anything, but I do believe that Sue might have something to share. So Sue McDonald that shared the Ventures program. So Sue, you're unmuted now.
I just wanted to comment on a theme that came through in several of the initiatives, and that was the connection with the outdoors. And as a counselor, I am really seeing the power of connecting our young people and also our staff with the outdoors. And I think it's easy to get hung up and think that it requires, so much planning or whatever. But I think being creative and figuring out how you can make that work, whether it's taking a group out to do photography or journal or a walk and talk or whatever, and also thinking how you can perhaps make that be a win-win for the community or an organization in the community, because then it serves two purposes. Like I was sharing about how we go and clear brush for our cross-country ski trails. And my students absolutely love it, right? They're picking up big logs and chucking it, and they're learning how to use tools and all those things. And we're providing a useful service to the community, the cross-country ski community. And they're very kind to us and give us a discount, although that's not the reason why we do it. That's just another added little perk. But so, you know, there's a few things kind of that can be embedded in all of these things that I think is important to perhaps think about how it can be, you know, a win-win. We go to a community garden that's quite nearby, and students volunteer in the garden, which is very therapeutic as well. And we have a community garden there. They've given us a plot in our school, so we do some growing there. So we go and volunteer, and then we actually get some stuff to take back to the school. So there's lots of things that don't cost a lot of money, because as we know in the education world, money is it seems like it's always tight, right? And it never is as free as we would like, which is why we're thankful to receive help, you know, with the Share2Care grant. But I think there's lots of creative ways that people can connect to their community, and sometimes it's just a matter of asking, right? You know, what can they say? They can say no, but maybe it's just a matter of being creative and figuring out how you can partner with another organization, right? So like we have an elementary school right next door to us. So we partnered on the rink. So our students received training. They learned how to use the fire hydrant, but we also ran opportunities for the younger students to come and learn to skate. So my students helped do some skating things. So that was a real win-win for everyone, right? Everyone was benefiting, and it wasn't hard. So it's, I think, creativity and brainstorming and getting, you know, staff involved in that process as well, because it is not a coincidence that many of these initiatives are connected to outdoors and nature. I mean, I'm an outdoor geek for sure. I spent the whole day outside today, but there's a reason why that is. I mean, just Google forest bathing, right? See what goes on in other countries. There's a reason why. And I think it to help to connect our young people and the people who support the young people with the environment has so many benefits. And it maybe doesn't need to be as hard as we think it does. So I'll step off my soapbox now, but.
No, that's great. Thanks for sharing. I thought as well, I was starting as I was listening, even though I've been involved with the Share2Care campaign and listening and reading many of the initiatives, as we're sitting here tonight, really starting to see that outdoor connection, and even many of the conferences that we attend or events and the importance of the outdoors and how, you know, it's starting to come more to the forefront, and hoping that schools are able to adopt that more. A lot of the initiatives we were seeing, many of them starting their day just with morning announcements or national anthem would be outdoors. It's also a time where parents are invited to stay, and just gives, again, that sense of belonging and connection to the school. The parent-staff connection, the parent-child connection is still there for a little bit longer before the parents have to rush off to work for many of them. So it was really a theme that we're starting to see, and great to see tonight as well.
Exactly.
All right, so I'm just looking at our time. So we are coming down to the end, and I don't believe there are any questions that have come up. So I just want to thank everyone for attending tonight and taking time out of your busy day. I did want to just share some of the upcoming webinars that we have with the Teacher Resiliency Education Series and what those topics will be. So you can see there on the screen that in August, we will focus on developing a culture of mental wellness in your school community. So right in time for the beginning, or planning for the beginning of the school year. In September, we will focus on teacher wellness. the school year has started, and there's many things going on for many teachers. And then finally in October and November, we will look at pre-service teachers, resiliency, and stress management at that time. If you want information about those, there's our Facebook and our Twitter platforms, as well as the link you see at the bottom, phecanada.ca/user/register/free, allows you to register as a supporter of PHE Canada, which provides you a chance to receive our monthly newsletters that are electronic emails. And so you receive those, and it would give you the information on the webinar when it's launched and how to register. So you can keep an eye out for that. And then the last thing just to share is if you did want to contact us with any questions, both my contact or email address is there on the screen, as well as Dr. Rodger's. So we're happy to answer questions if you would like. We will send out an email after that will come directly from the system that we use for the webinar that says to thank you for joining us this evening, but also provides you with a link to the recording of the webinar, and we'll share a link to a short evaluation. We'd love to hear from you. It's pretty short, no more than 5 minutes, if that, to share how the webinar was useful for you and what we could do to improve or enhance for the future. And so, yeah, just a big thank you to everyone taking the time out, and you will get that email in the next day or so. So thank you and good evening.